For a full decade, a cardiovascular threat can quietly tear at your arteries. It causes microscopic damage to the inner walls, all while producing exactly zero outward symptoms. You won't feel dizzy, you won't feel pain, and you won't even know it's happening. That condition is hypertension. Medically, we define it as a consistently raised systemic arterial blood pressure, meaning the physical force exerted by circulating blood against your blood vessel walls stays abnormally high. The exact clinical threshold for this diagnosis is a systolic pressure, the pressure when your heart beats, of 140 millimeters of mercury or greater, and a diastolic pressure, when the heart rests, of 90 or greater. If allowed to continue untreated, that pressure accelerates atherosclerotic buildup. Over time, this translates into severe complications like coronary artery disease, acute heart failure, and ischemic stroke. Because you cannot feel this damage happening in real time, the only strategy to defend against it is to implement a strict system of clinical tracking and measurement. When a patient enters the clinic, a physician's first objective is to categorize the disease's origin. We must know what drives the pressure up. Most cases fall under primary or idiopathic hypertension. This means there is no single definable underlying biological cause. The high blood pressure itself is the primary disease. Secondary hypertension is different. In these cases, the elevated blood pressure is driven by a specific, identifiable, and localized internal issue. Medical triggers for secondary hypertension range from chronic renal disease and obstructive sleep apnea to endocrine disorders like Cushing's syndrome, where the body produces an excess of cortisol. Accurately categorizing the disease is essential. If a doctor only treats the symptoms of secondary hypertension without addressing the underlying organ dysfunction, the cardiovascular damage will continue unchecked. Getting an accurate read on that pressure is surprisingly difficult. Up to 35% of patients experience the white coat effect, a phenomenon where the mere stress of being in a medical environment causes their blood pressure to spike, creating false positive readings. To bypass this hurdle and capture a true baseline, physicians rely on home blood pressure monitoring using validated upper arm cuff devices. This protocol demands strict environmental preparation. The patient must sit quietly for 5 minutes in a comfortable room with an empty bladder. Posture is heavily regulated, back supported, legs uncrossed, and feet flat. The testing arm must be bare, resting passively, exactly at heart level. There are also strict prohibitions prior to testing. Patients must avoid caffeine, exercise, and smoking for 30 minutes before taking a reading. This data matrix outlines the required time frame. Measurements must be taken twice a day, morning and evening, for a period of 3 to 7 days. Those readings are then averaged together. Adhering to this rigid, repetitive protocol strips away daily environmental variables. It removes the guesswork and reveals the true underlying state of the patient's cardiovascular system. Once a true diagnostic baseline is established, the definitive first-line defense isn't always a prescription pad. For many, it requires a structural overhaul of their daily lifestyle. The medical standard for this is the DASH eating plan. It involves a diet highly concentrated in fruits, vegetables, and low-fat dairy, while heavily minimizing total and saturated fats. The most critical, non-negotiable dietary restriction is sodium. Intake must be strictly limited to no more than 2 grams per day. Then there is the clinical cardiovascular exercise requirement. Patients need 150 minutes of moderate aerobic exercise or 75 minutes of vigorous exercise every single week. That aerobic base must be complemented with a secondary muscular requirement. Engaging in resistance training 2 to 3 times a week helps optimize overall vascular health. A few final daily habits lock the prevention strategy in place: maintaining a normal body mass index between 18.5 and 24.9, moderating alcohol intake, absolute smoking cessation, and utilizing mindfulness techniques to reduce chronic stress. Hypertension is an invisible and lethal threat, but by categorizing its exact origins, executing precise home measurements, and committing to this behavioral blueprint, we gain the power to diffuse the pressure and protect the cardiovascular system.